And let me introduce myself. I'm Dr. Mitra, your ophthalmologist in Northern California with 2 locations in Roseville and in Grass Valley. I am the owner of Capital Eye Medical Group, where we help patients gain their best potential vision so that they can live life fully and enjoy their hobbies for years to come. I am here Monday morning with another Facebook Live, as promised. I'm preparing to go into my clinic today. Some of you I may be seeing here. But essentially, I wanted to talk about how you can prepare for your eye exam. Whether you're going to your ophthalmologist or your optometrist, essentially there's a few things that we would really love to have, and it would make your life easier if you prepared for it. So first thing is that if it's your yearly exam, more than likely your eyes are going to be dilated, more than likely. So just prepare for that by making sure that you have a ride to and from your eye exam. Make sure that you have at least an hour set aside, and that's if the doctor is not running late or patients aren't late, so that they don't run the schedule a little bit past the time. So just make sure that you have a ride, because your eyes may be dilated, and if it's sunny outside, not like today, but you may not do so well with driving in the bright sun, even when you get those glasses. Which brings me to point number 2. Make sure you bring good sunglasses with you for after your exam. So once you come in, if there is some paperwork, registration paperwork that you could have filled out online, please go ahead and do that. If it's something that you could have sent in, go ahead and do that so that your check-in process is going to be fast. Bring your insurance cards, whether it's a medical exam or if it's a vision service plan. Just make sure you have the information so that the check-in people can let you know what your share of cost may be, or whether you have a copay or anything like that. Next is you want to make sure that you have an excellent idea, basically a list of your medications, and any medical history that you have is going to be important no matter what doctor you go to. So for me, I like to know everything. Are you on blood thinners? Why are you on blood thinners? Do you have a history of a rheumatic disease or rheumatoid arthritis? Are you on medications that can affect vision? That's why even if you think the medication is not important, I would like to know exactly what you're taking. And also a list of your medical problems. I can probably figure it out from the medications that you take, but it's always good for you to know, do you have diabetes? Do you have hypertension? Again, are you on blood thinners? Do you have atrial fibrillation? Anything like that. And also family history. So if there's a family history of macular degeneration, if there's a family history of glaucoma, and whether or not it was something that and this is mainly in the first degree family members, like brother, sister, mom, dad, whether or not they had to have surgery for the glaucoma, or were they just taking medication. That gives me an idea of, how well controlled it was, or doesn't change my treatment. I'm still going to do the same type of, exam, and make sure that I'm following you closely and doing the appropriate testing, because some diseases, some eye conditions, when you have a family history of it, or a medical history in the family, then I will be paying a lot more attention to that. Otherwise, let's see. So during the exam, in some offices, you have the option of not having your eyes dilated, but you can, if they have fundus photo or a camera that takes pictures through the small pupil, you can have pictures of the retina taken, and that may be an additional cost. If you have a medical history that justifies billing that to the insurance company, we usually try to, take care of that. But some people just don't want their eyes dilated, and that's definitely a choice that you have. So you can choose for that, just know that there is a cost and make sure that you're aware of it in advance. So if you do that, it's obviously a lot easier to get in your car and drive away, and maybe you don't need a ride. However, I always tell my patients that if there's something suspicious within that fundus photo, if there's something towards the periphery or something that I can't visualize, I may still have to dilate you. It's rare, but it can happen. What else? I think those are the main things. Once you're, be patient. Right now, especially, we are, I think every single office is probably short-staffed. We're trying to get to patients as quickly as possible. We're trying to get everyone in that needs to be seen. Obviously, the urgent cases or the more acute cases come first, but we are trying to get to everyone. So please be kind to the check-in desk, the checkout desk, and all of that. Also, make sure that before you leave, you've already set up your visit for the next appointment. So if it's a yearly exam, or if you're a glaucoma patient, maybe you have to be seen in 3 months, please make sure you've done that. Please make sure that if you need any refills on your medications or anything like that, that you've already let the doctor know or the tech know, and that way we can make your visit more efficient. Otherwise, if you have any questions, make a comment. If you're watching this as a replay, I'll be more than happy to respond to your comments. Otherwise, I will see you next Monday, same place, probably, same time, Monday, 8 a.m. PST time. And I hope you have a wonderful